Welcome to KLBiologyNEET. In this video, we are going to discuss cardiac cycle and heartbeat. Before that, children, let us see the previous video question. See what was the chronological event happens during ventricular diastole, ventricular systole. Yes, SA node, of course from there AV node, bundle of S, and then Purkinje fibers. So this is the event of conducting impulse in order so that the ventricles can contract. Yes sir. Okay. Fine. Now let us discuss the cardiac cycle. Already we discussed the cardiac cycle includes major three events. What are they? One is auricular systole. Next is ventricular systole. And joint diastole. So you know auricular systole already we discussed, children. 70% diffuse on its own to the ventricle, remaining 30% only active contraction. Ventricular systole we know SA node has to send impulse to AV node, then bundle of S and Purkinje fibers so that the ventricle can contract and pushes the blood to the aorta and pulmonary artery. Joint diastole, when all these valves were closed, okay, both tricuspid, bicuspid and also semilunar are closed, it is what we call it as joint diastole. So all these three events happens within 0.08 seconds. So one cardiac cycle takes around 0.08 second. Possible question. Fine. Now let us see heartbeat. So each beat it takes 0.08 second, means heartbeat per minute it will be, yes children, it is 72 times per minute. Okay, and each time when the ventricles contract, it pumps how much blood? That blood is called stroke volume. So each time when ventricle contracts, it releases around 70 ml of blood. Then they may ask you what is the cardiac output. How to calculate cardiac output? Just we have to multiply heartbeat and stroke volume, which is 72 into 70, oddly it will come 5 liter, children. I hope you all understood. Sometimes they may give you heartbeat is 62, stroke volume is 80, then find out the cardiac output. So this is just multiplication, you have to find out the answer. Fine. Does heartbeat remains normal all the time? Yes, it won't be. Very correct answer. When and all it will change. So heartbeat changes during exercise, fever, excitement. All these time it will increase. Of course, pregnancy time also it increase. When we are asleep, that time of course it will decrease. Okay, the increase of heartbeat we call it as tachycardia. Increased heartbeat. Decreased heartbeat we call it as bradycardia. So this is regarding the heartbeat. Okay, our heartbeat is under the control of both chemical as well as neural control, children. So what are the hormones that control heartbeat? Let us see. Of course, the increase of heartbeat is due to adrenaline and noradrenaline, and also thyroxine hormone. So these two will increase the heartbeat. In case of nervous control, sympathetic nervous system increases the heartbeat. As you know, sympathetic nervous system again includes the adrenaline as their neurotransmitter. Whereas acetylcholine on the other hand decreases the heartbeat. This is also a neurotransmitter only. But of course children, our heart is myogenic and it is under the control of muscle fibers only. Okay, let me ask you a question now. You know, vagus nerve is the longest nerve. If we cut the vagus nerve, what will happen to the heartbeat rate? Will it increase or decrease? Can you post your answers in the comment box, children? Thank you all for watching this video. If you have any doubt, please follow me on WhatsApp, Instagram, Telegram and Facebook. Thank you all.